So I'm going to officially welcome you all now. Thank you so much for joining, whether you're watching this live right now or viewing this as a recording. We're very happy to have you here. My name's Naomi Hoffer, and I'm the program manager for the Sheri Sobrato Brisson Brain Cancer Survivorship Program. And this webinar series is part of a number of offerings that we are doing at UCSF Neuro-Oncology. Part of that doing this is because of a generous grant that we received from Sheri Sobrato Brisson to develop a UCSF Neuro-Oncology Survivorship Program that we're very proud of and we're continuing to develop. So this webinar series is a monthly series for those dealing with brain cancer. And we have other offerings as well. We have wellness classes. We have a cognitive consultation clinic, and we're going to be hearing more about that. And other things that we're developing as we go along. So we are partnering with you, and we love to hear your feedback. We hope that you will offer feedback of this webinar, as well as continue to be in contact with us as we grow our program. So it's my pleasure today to have three wonderful panelists. We have two panelists that are from our survivorship program, our cognitive consultation clinic. Alexa Greenstein is our nurse practitioner for our survivorship program, and she's going to be here to talk with us today about brain cancer and its effects on cognition and some wellness activities that you can do to support your cognition. We also have on the other side of your screen, you'll see Christina Weyer-Jamora. Dr. Weyer-Jamora is our neuropsychologist, who is our premier neuropsychologist in our cognitive consultation clinic, who does assessments and rehabilitation for patients with brain cancer. So I'm so delighted to have both of them, and really thrilled also to have Lilly Stevens-Bell with us. Lilly agreed to be our survivor voice on this webinar. We always want to try to include survivors' voices so that we can really learn more from a personal perspective of what this journey is like, and we can hear from Lilly her best practices and things that have worked for her and challenges she's had. So we'll hear from Lilly throughout. So thank you all to my panelists for being here. So Alexa, I'm going to turn it over to you.
Thank you so much, Naomi. Hi, everyone. Thank you so much for joining this evening. Again, my name is Alexa Greenstein, and I'm a nurse practitioner that works with Naomi and Dr. Weyer-Jamora at UCSF in the UCSF Neurocognitive Clinic, which is part of the Sheri Sobrato Brisson Brain Cancer Survivorship Program. I work closely with patients and their caregivers to help manage cognitive challenges. My hope is today you'll find some helpful information regarding this important topic. As Naomi said, if you have any questions, please feel free to submit those at the bottom of your screen. So now we will get started. All of us from time to time have had the experience of forgetting a word that we were trying to say, lost our keys, went into a room and forgot why we went in there, or even where we parked our car. These are common lapses that everyone experiences, especially when we're tired or stressed, but more so when there are changes to the brain itself. Cancer-related thinking changes are common. Cognition can be defined as a mental action or process of acquiring knowledge or understanding through thought, experience, and the senses. These processes include thinking, knowing, remembering, judging, and problem solving. There are higher level functions of the brain which encompass language, imagination, perception, and planning. More than 50 to 90% of individuals with brain tumors are thought to have cognitive changes, with patients reporting greater than 80% of cognitive symptoms related to brain cancer. Cognitive changes can occur at the time of the brain tumor diagnosis, during treatment, or even several months to years after treatment. The severity of these changes can be temporary or last throughout the disease course. Cognitive impairments are often described as one of the most debilitating and distressing symptoms of brain tumors due to its high impact on quality of life. Cognitive impairments often affect your independence, social and personal relationships, and performance at work and school. Day-to-day activities that were once automatic now can take much more time and effort to do. Furthermore, these changes may not be readily apparent to those around you, unlike a broken leg. Even though these cognitive changes may be invincible to others, it's still a very real problem. Many of our patients describe feeling distressed by their forgetfulness and slow thinking and how this negatively impacted their day-to-day functioning. These are many of the comments we hear from our patients and caregivers. I don't feel like myself. I'm living like an outlier. I'm scared. Since we know that many of our patients will report cognitive and emotional changes in the midst of their medical course, all the more reason for us to think about what to do to provide services to address these issues. It's important to remember that not everyone with a brain tumor will have thinking difficulties, but the areas that are most commonly affected by brain tumors and brain tumor treatment include the following: attention and concentration, memory, executive functions, and processing speed. So what are these exactly? Attention and concentration is our ability to focus and respond to stimulus. People who experience difficulties with attention and concentration may have trouble remembering or experience memory lapses, trouble concentrating, or they can't focus on what they're doing, have a short attention span, may easily space out, or have trouble remembering details like names, dates, and sometimes larger events. Patients may have trouble multitasking, like answering the phone while cooking, without losing track of one task. Memory is our ability to learn, retrieve, and retain information over time. People who experience difficulties with memory may experience trouble recalling conversations, details such as remembering their medications and appointments. Executive functions is our ability to anticipate, understand, and control our actions. People who experience difficulties with executive functions may experience trouble organizing, planning, making decisions, solving problems, or reasoning. Processing speed is the speed at which it takes to complete a task or process information. Tasks may not be performed as timely and efficiently, and greater effort is required to complete tasks. For many people living with a brain tumor, cognitive changes are often a part of management of their disease and change depending on many factors. Commonly, individuals experience changes leading up to their diagnosis. After diagnosis, other factors such as rate and spread of brain tumor growth, surgical management, chemotherapy, and radiation can impact patients' cognitive experiences. Further, medications such as steroids and anti-seizure medications can influence cognition. Cognitive changes are often not linear. For example, many individuals can experience cognitive recovery in the months after surgery and radiation, particularly in the areas such as attention and concentration. While others may not have similar recovery, other factors can play a part in the expression of cognitive symptoms. 3 of the most common areas we focus on in the neurocognitive clinic are metabolic factors, lifestyle recommendations, and mood-related symptoms, since these areas may be exacerbating individuals' current cognitive symptoms. The good news is that many of the metabolic and mood-related conditions respond well to treatment and can be integrated into one's brain tumor treatment plan. Cognitive function is profoundly affected by unbalanced levels of hormones such as estrogen, thyroid, and cortisol. There are also several dietary inefficiencies such as zinc, thiamine, and folate that have been associated with compromised cognitive abilities. The brain and the mind are intricately interwoven. For this reason, any change in cognitive function can influence how people feel about themselves and can reduce a person's self-esteem and sense of mental sharpness. Stress, anxiety, or depression can make a person more forgetful. Infections and activated immune responses can affect the brain through several pathways, which can affect cognition. Specific lifestyle activities such as diet, level of physical activity, and substance use have shown to play important roles in our cognition. As part of the normal aging process, some of our brain functions begin to decline as neurons die and the mechanism to replace these neurons become less and less efficient. Increasing age is one of the strongest known risk factors for cognitive impairment. Chronic health conditions like high blood pressure, elevated blood cholesterol levels can block vital blood flow to our brain, which can influence our cognition. There are some neurodegenerative diseases of the brain that you may have a genetic predisposition to. And as previously discussed, steroids and anti-seizure medications can influence cognition. But there are also other drugs that can impact cognition, such as antihistamines and opioids, which are pain medications. What are some steps you can do to help optimize your cognitive function? If you are experiencing difficulties with thinking changes, let your doctor know. Talking to your healthcare team about this can help your doctor understand how important this is to you, and screen and consider modifiable medical factors, such as medication changes or additional medical workup. Also, this can begin a conversation regarding cognitive education management and other cognitive care provider referrals. One common cognitive management referral that many of our patients start with is either cognitive and emotional screening with a medical provider and/or being referred to a neuropsychologist for neuropsychological assessment. Good management of other medical issues is really important. Particularly pay attention to vascular-related factors such as blood pressure, blood sugar, and cholesterol, as we know lack of management of these issues can further complicate cognitive health. Treat fatigue, anxiety, depression. Yes, your emotional state will impact your cognition. Improve your psychological well-being and focus on getting regular restorative sleep. Think about making a positive lifestyle change, such as eating healthy food. A healthy diet can help reduce the risk of many chronic diseases and may also help keep your brain healthy. For those who are interested, many of our patients have found benefit with consultation with Dr. Donald Abrams and watching his video library talks on the UCSF Integrative Medicine website. We additionally will be having an upcoming webinar about nutrition. If you would like more information, please let Naomi know. Physical activity is an integral component of managing cognition. Many studies have found positive effects in reducing the expression of cognitive impairments. Engaging in physical activity and exercise also helps to manage stress and can be a real mood booster. In particular, several studies have associated aerobic exercise, such as brisk walking, with better brain function. Make exercise a regular part of your routine. But before getting started, please speak to your doctor who can help guide your exercise intensity and routine. Our recent exercise webinar with exercise therapist Reagan Frederick may also give some ideas on where to start. Last but not least, cognitive rehabilitation has proven to be effective in patients with neurological conditions such as traumatic brain injury and stroke, and there's emerging evidence for efficacy with primary brain tumors. We are excited today to mostly focus on understanding the role of neuropsychology and cognitive rehabilitation in managing cognition in brain tumors. To help us to do that, we have Dr. Weyer-Jamora, who heads up our neurocognitive clinic here at the UCSF Brain Tumor Center. Additionally, we are so grateful to have Lilly Bell-Stevens, our amazing brain tumor survivor, to speak about her experience with cognitive rehabilitation in the neurocognitive clinic.
Thank you so much, Alexa. I appreciate that. That's really thorough information. And now I'm going to turn it over to Chris and Lilly. But before I turn it over to Dr. Jamora, I'd like to actually ask Lilly. Lilly, are you able to talk a little bit now about your experience after having gone through brain cancer treatment and kind of what that was like for you, what you noticed about your thinking ability and what was most stressful for you and problematic for you?
Hi, it's so nice to be with you all this evening. Thank you for letting me be here. Yes, I'm a brain cancer survivor. I was diagnosed in 2017, the end of 2017, and I've had two surgeries. I've had a about golf ball sized astrocytoma in the left lobe, and so I noticed a little bit before I was diagnosed, and then of course after my surgeries, I noticed a really big difference in my ability to retrieve words and to be able to put things in order. So I dealt with fatigue, many symptoms attached to it. It's like our world kind of turns upside down. So a lot of the things that Alexa just talked about, I'm sure you felt similarly, but I really struggled with that. I was in school and was in an intensive medical program that was a year and a half. So I came to meet with Chris toward the end of that program, starting my internship and then starting to work. And that helped me to kind of move through that really difficult period.
Thank you, Lily. And I just wanted to ask one follow-up question. How did you know to ask for help even? I mean, rather than just kind of live with it and think this is something that you're just going to have to deal with. How did you know to even find Chris?
That's a really good question. So I had worked with like speech therapists the year before, and I just was helping a little bit putting the pieces together, but I talked to my neuro-oncologist after my MRI, and she actually recommended working with Dr. Jamora, and it really made a huge difference. I'm so glad that she was able to connect me with her.
That's wonderful. Thank you so much. Dr. Jamora, I'm now going to turn it over to you. Thank you so much for being here. And I know we're all going to benefit from hearing what you have to say. I learn from you every day. I just have to say that. So I'm so delighted that you are part of our survivorship program.
Thank you so much. It's really, it's an honor to be here today and to be able to talk with Lily and all of you about something I feel so, so passionate about. So thank you so much. So again, my name is Christina Weyer-Jamora. I am a neuropsychologist in the Department of Neuro-Oncology here in UCSF. I'm also the Director of Neuropsychology Services at San Francisco General Hospital. I study and work with individuals with brain tumor and who experience changes in their thinking. And in this work, both in my clinical work and my research, our goal is to try to understand these changes, but moreover, to help individuals live well despite having these cognitive changes. And that's really what we feel very passionately about. So today we'll discuss, like we've been talking about, some typical changes that people experience after either in the course of the diagnosis of brain tumor or also as it relates to their treatment course, as well as begin to think about what we currently understand, what can help with that. And then Lily and I will go back and forth talking a little bit about our work together, both as we think about it from the research perspective, as well as Lily's lived experience in terms of applying some of those concepts to areas of her life that she valued. So that's our goal today. And then afterwards, I'm happy to stay in the hangout and answer any questions, or just be there to be part of the hangout afterwards. So neuropsychology, it's a very big word, but it's really the study of brain behavior relationships. So for example, when we want to come up with a word to describe something, just like in this picture over here, or if we see something, that information gets transferred to various parts of the brain in terms of, so it can be processed further. So it is a dynamic process in the brain. Something that's so simple as naming something can be both, first you see it, then you hear the word, and then it gets processed in various parts of the brain as we see here. So at any point of the process, you can encounter challenges. Rehabilitation neuropsychology interventions are designed to improve cognitive, emotional, and psychosocial functioning through interventions designed to help optimize learning strategies and making use of your strengths, as well as retraining certain functions of the brain. In truth, the best way to fully understand your cognitive strengths and vulnerabilities is to undergo neuropsychological evaluation. And information from neuropsychological testing can be very useful and helpful in learning about your strengths and what to do about the challenges that you face. Oftentimes, these evaluations can also help to advocate for reasonable accommodations at work or at school that are needed. And your oncologist or primary care provider can refer you and talk with you further if now is the good time in your treatment course for that sort of evaluation. Next. So cognitive rehabilitation is a systematically applied set of medical and therapeutic services designed to improve cognitive functioning and participation in activities. So Lily, maybe if you wouldn't mind, so that's the formal definition, but maybe you can talk about and think about, looking back when we were working in cognitive rehabilitation, what are some of the major ways that that you experienced cognitive rehabilitation and the overall interventions?
I was looking here to see if I had written any notes here, but I think when I first started meeting with you, I was having a really difficult time concentrating. I was really tired. And so finding just some tools to know how to manage, it almost felt like a road, and there was it's like a closure or had to reroute. So it's like rebuilding those roads or pushing through them. And that's what it felt like when I was working with you, is learning how to use different senses. Like, as you see now, I have to gesture a lot just to kind of pull the words out of my brain. So it's learning those skills to work around it, or just using other senses and learning to just stop and be more aware.
Mm-hmm. That's wonderful. I think that's, I think it really shows and speaks to how much and how hard you worked in this process, which
a lot of work.
And cognitive rehabilitation, as many of us know, is shown to be effective in addressing cognitive changes in a variety of neurologic diseases. Mostly it's been studied in traumatic brain injury and stroke. That's where a lot of the research and data is. And there's some promising data, some newer data coming out for sustained cognitive improvement and reduced mental fatigue in individuals with glioma. And we currently have a clinical trial right now at UCSF trying to unpack that a little bit more from a systematic research perspective. So I'll be excited to, whenever we have some results later on this year, to look at some of that data together with our research team. So in particular, cognitive rehabilitation plays a critical role in optimizing health and quality of life. And really the best rehab is those that work from Lilly, your experience, where asking what's important to you, or the patients really kind of sitting down and talking about what do you value, and what are the things that are troubling you, and what can we do about that. So starting with you and then working outward from there.
Yes.
And some patients will ask me, so how exactly does this work? What is the mechanism? And honestly, it's not well understood. We have some theoretical concepts, and we have some beginning basic neuroscience to suggest that it does work off of the hypothesis of neuroplasticity. And it really helps to activate alternative networks by using compensatory cognitive mechanisms. So as we often talk about in our our neurocognitive clinic, the brain is very survivalist oriented. And so it is oftentimes trying to reorganize itself just to get its needs met. And we've looked at some beginning MEG data about neuroplasticity, and MEG is a type of neuroimaging that looks at how cognitive functions are being distributed. And so we do see changes, we have seen changes in the way cognition is being transferred in various parts of the brain before and after rehabilitation. Again, this is a very poorly understood mechanism, but things are looking promising. Research is promising that enough so that we will continue to investigate why it is that people do experience improvement. When we think about neuroplasticity, there's neurogenesis, so there's new neuronal sprouting. There's reorganization of current pathways, and there's two areas that there's one area in particular has a greater affinity to reorganization. The cortical area, and especially in slow-growing tumors, that's able to harness that neuroplasticity, and then unmasking dormant pathways. So those are all mechanisms that we're trying to understand. And even though even if the retraining or the cognitive rehabilitation doesn't directly modify the cognitive impairment, so we don't see any score improvement on neuropsych testing, it can still improve the overall level of functioning by it not taking so much effort and fatigue to complete cognitive tasks. And there is some research, there's a less diffuse pattern of cortical activity as it relates to certain cognitive processes after rehabilitation. So how do we think about this. So there's two different ways that generally I'm talking with patients about cognitive recovery. One is retraining, and the other one is compensatory strategies. And so so retraining is actually strengthening the vulnerable cognitive skill through repeatedly practicing neurocognitive tasks. Now, this is a little bit different than luminosity or some of the other general retraining software out there. I really do caution individuals that there's just not been really good evidence, even very large scale studies, in terms of the benefits of some of the more generally available software packages. So, and oftentimes those sorts of interventions need to be guided by a cognitive care specialist. So if that is something that you're interested in, making sure that you're talking with your doctor about the benefits of that. So retraining means re-strengthening that cognitive skill. The cognitive skills that are most that have the most evidence for improved for remediation is attention and concentration. So attention and concentration does respond nicely to remediation. Also some language-based impairments. So individuals that have some difficulty speaking or understanding, there are some evidence that that can also improve by an intensive course of retraining. To be able to find words and be able to describe things. As Lilly kind of talked about earlier, whenever you went through some speech therapy to improve those processes, right?
Yeah, exactly.
Yeah, exactly. And then there's compensatory strategies. So that's just a really kind of complicated way of saying working around problems. And really compensatory strategies, while some people have said that they feel like a cheat, that been doing things in a different way, what I oftentimes say is that learning a more efficient way to harness your strengths to meet your goals is not cheating at all. It's just working smart. So, you know, I think that, and oftentimes these two mechanisms are studied in combination, and there's no current consensus when to start cognitive rehabilitation, but the current thinking right now is that individuals should be off active treatment. You know, I do see some people that are still on active treatment, but oftentimes it can be very difficult from they're experiencing some side effects from the chemotherapy or the radiation. So, and there's also a lot of intensity of appointment burden. So usually we start cognitive rehabilitation, and there's one more thing. Also, you can have some improvement from recovering from radiation and being off active chemotherapy too. So while it's typical that we wait until people are off their active treatment course for a variety of reasons, there have been exceptions where I'll see individuals for cognitive rehabilitation for this type of intervention when they're on some active treatment. And so Lilly, I'll pause there. Maybe, do you want to say a little bit about what you experienced, the difference when we were doing retraining and some of the kind of attentional exercises versus when we were talking about kind of load management, like managing your load and things like that?
Yeah, I really like this picture that you have here, because that's what it feels like when I first started working with you, that space between the two lines felt a little wider. And then as we learned these different like compensating and retraining, you can feel it in those weaker areas, or I think you have another word for them, but it was like those areas where needed to be worked on. Like I have here was like, I feel like, let me see, compensating or like learning how to use, like, because I'm a very visual or textile kind of person. So it's like taking photos, like if I needed to focus on something or learn a new concept when I was at school, or if I was trying to find like a parking spot for an appointment, I would take a picture and I would stop and like visualize, okay, where am I? So that it just kind of having to slow things down, and then using these different senses, or like I would take notes on my hand even if I didn't have paper. So it's like learning to just kind of work with what I've got. But I'm trying to remember, you have a lot more vocabulary than I do in that area. But
well, maybe, so let's talk about the process of compensation model. So we talked a little bit about retraining, and
yeah,
then we also talk about that there's a lot of factors, like you were saying, that go into whether or not somebody has a slip or a cognitive, their vulnerabilities kind of rear their ugly head, so to speak, where there's up here, there's the expectation. So we can have pretty high expectations of ourselves, and our environment can have pretty high expectations of us too. So professors might not be aware that we need accommodations. Other people might say, wow, you look fine, you're doing great. Like, I mean, I have forgetful slips too. And of course, sometimes those comments can be variably helpful. So the expectations or the environment can have one impact, but then also our skills have changed, and we may or may not be aware of how our skills have changed, right? So there's some parts of the brain that mediate awareness, and that might be affected too. So we might think we could do more than we could, or our mood is not all that great, so we don't think we can do anything. So there's that gap between what we expect of ourselves and what others expect of us, and then what we can actually do, right? And so what we talk about in rehab is minding that gap, minding the gap and make it shorter and shorter. So that way, yes, maybe there still is some slips, and maybe there are problems day to day, but we can anticipate some of them. We can manage expectations. We can get workplace accommodations, and we can do some remediation to make it so that way it's not such a vast gap between the two.
Yeah, like learning those skills to do that.
Yeah, absolutely. And so this is a model that has been used in traumatic brain injury and stroke, as you can see, since the 90s. And so we're now validating and looking at it in the and many other populations. We're now validating and looking at the brain tumor population. And so far in my clinical practice, I think we're finding benefit in a very similar way. So let's go to the next slide. Oh, fatigue, for the fatigue of it all. Running out of energy fast and starting off with less. So about 40 to 70% of patients with brain tumor, primary brain tumor, report having fatigue during their illness course. And although fatigue is prevalent throughout the disease trajectory, we know especially cranial radiation there's a lot of research to suggest that cranial radiation can have a pretty significant impact on fatigue, and that more than 80% of patients with a primary brain tumor report fatigue in the course of radiation. So radiation is a pretty big impact, and there's a so again, these mechanisms are still under investigation, but there's a neuroinflammatory response. And additionally, there can be a demyelinization and a remyelinization process with certain structures of the brain that make it so that way you have to work harder for many reasons to do the same task. And so Lilly, so this is a model that we've talked a lot about. So this is, Lilly and I have talked a lot about this together. This is the Yerkes-Dodson curve, that there's a relationship between what we can do and how much stress or toll that takes on us. And that our goal is to stay out of the red as often as possible. That the goal is to not do as much as you intended to do, but do as much as you can do with as much energy as you can, because as we, and we'll talk a little bit more later about the overdoing cycle, about how that impacts if you're staying in the red more often. But maybe Lilly, you can talk a little bit about, whenever you and I were working through this, what your thoughts were about how you integrated fatigue management and pacing into your work.
Yeah, this section of when we were working together was like an aha moment almost for me, because I don't think I had really taken the time to update myself. And so when I saw this, it was just so awesome, because I was able to kind of give myself a way of just kind of figuring out where I was at. So I think what we first started doing was kind of making a log of when I was having these moments where I would slip, heavy slips, or I felt more tired. I just was starting to be more aware of okay, am I in this green area? Am I in this optimum stress, or am I burning out? So when I was first started meeting with you, I think I was spending most of my time in the orange and the red, and I didn't even know it. So it was learning to just, like you said, pacing myself. I had to readjust the amount that I could do, kind of budget my energy, and know this is what I'm dealing with, like my baseline now. And that changes, of course. So just kind of, even in a moment or in like a calendar. So like this week, okay, how am I going to keep this within this optimum sweet spot here? Or if I'm in a situation where I am going toward this anxiety or exhaustion, learning that skills to kind of bring it back and recenter so I can function instead of burn out and go in that terrible cycle.
Yes, and we're going to talk about that terrible cycle. So I think that what you say is so true, that when we're tired, we just struggle to be the best version of ourselves.
Yes.
And particularly whenever you're struggling with chronic medical challenges, your brain, and especially with brain tumor, your brain has to work harder to complete the same task. And that other people might see that, oh, well, she can do it, but they don't see all of the effort that it takes.
It's going on inside.
Like, oh, I've got smoke coming out of my ears. Like, I'm working so hard to make this happen. So, and as what I noticed, I think that was really wonderful to see that as you began decoding this and problem solving it and making it your own, using calendaring to keep track. And then if you needed to budget additional time on the back end. So for example, if you had clinicals and you're like, no, I have to be there for 8 hours, then really decanting your schedule in the back end so that way you could recover.
So helpful. Yeah, it makes a huge difference.
Yeah. So this is that overdoing and underdoing cycle that we were just talking about. And some of the helpful questions so overdoing it, so we have increased fatigue, and then we have a symptom flare, and then getting prolonged rest because we're just done, we're exhausted. But then there's that guilt sometimes, or that pressure of building up of things to do. So then we go back to the overdoing, and it just goes on and on and on and on. And so some of the questions that Lilly and I talked about in treatment were, one, asking yourself at least twice a day, how much fatigue am I feeling, and am I red, yellow, or green? And starting off the day with that in the midday. And then how is what I'm doing currently workable? When I look at my schedule and I'm overwhelmed and I'm already at red, is it workable for me to do this? And what can I what can I do without, and what can I put off until later? What's in my control and what's not? Some things are out of our control and we have to acknowledge that. But if things are chronically out of our control and we're chronically over stressed, then that's a good red flag that, okay, well, I have to do some restructuring and I have to manage some of those expectations for myself, but also for other people. And what are some things I can tell myself to encourage me to pace? So, Lily, what are some of the things that you said to yourself in the moment that helped you remind yourself you could pace?
I think just reminding myself to stop if I could feel myself kind of pushing like that distance that you're saying, like, I need to do this, and then my brain is saying, no, you can't, this is not working right now. It's just to kind of stop and kind of, like you said, ground yourself, put your foot on the ground and just stop for a moment. Also, just reminding myself just to be patient, and like, I love the saying that you said, like prime time, just relearning that I need that time to just give myself a little bit of time, and then I could just get over that hurdle and then just keep going.
That's great.
Yeah, basically. But yeah, like you said, calendar, like planning things out, sticking to that routine. Yes, keep having that learning, that routine, like making sure I get enough sleep. So then I can maintain instead of go up and down. It's more like an even keel, so I can function longer.
Yeah, absolutely. And here with this other graphic, there's all these other things, right? So tracking your symptoms, exercise. We know exercise is helpful for reducing fatigue because we can become physically deconditioned. So while we might be really tired and don't think that exercise will help, but actually exercise does help.
Yeah, it does.
Getting restorative sleep, managing other cognition, other conditions, having pleasure as part of your life. That dopamine can be really helpful. That's what some of our researchers feel like, that doing something that's rewarding or pleasurable can also help us feel less fatigued. DeLuca is one of the researchers for that. And then I think there have been some small studies about the benefits of stimulant medication. I think that the studies have been conflicting, so the jury's still out whether or not the benefits are able to be had for individuals longer term. It is something that some patients do under medical direction, and if it's something you're interested, talking with your oncologist about that. But I haven't seen it being a panacea. It's more of something that that people will add perhaps, but it doesn't take the place of just the hard work of pacing oneself. Oh, overstimulation. So this is something that I think is one of the most common things that we run into, that sometimes what goes along with fatigue is overstimulation. So it's common that as the brain is not neurotypical anymore, or has some changes, that regulating stimulation in the environment is challenging. So for example, too much noise or commotion can lead to more irritability or distress, or just having sometimes people talk about, I just don't have as much bandwidth as I had before, or I'm much more sensitive than I was before, and I can get really upset really easily if I'm overstimulated. So we talk about managing your environment, turning off multiple input sounds, light, noise. Many of my patients have a particular sensory thing that that is harder for them, whether it's hearing lots of noise or visually busy kind of environments. Remember, the brain still has to process all of that and everything that you're doing too. So the more that we're making the best use of those resources, the better it will be. And then some others, they need some background noise. They need a little bit of background noise to filter out for them. So sometimes it's not all about all or nothing. Sometimes it's finding that sweet spot and finding your balance with it. There are some individuals that have a really strong sensitivity to noise, and some of my ear, nose, and throat colleagues talk about that can be, and if you have that along with some hearing loss, then that can be something that needs evaluation further and talking with your doctor about that. So if you have really noise sensitivity with some hearing loss, that's an important symptom to make sure and talk with your doctor about. And then Lily, were there ways that that you found to manage sensory overload?
The big one, and it still is actually, is I remember right after my surgery, particularly, like I would be going into just a place that had like brighter lighting. I was really sensitive to it, or if it was big crowds. Like I went into Target and I was like, I can't do this. So it was like just so much, and I wasn't used to feeling that way. And so that's what I had to learn, kind of just by trial and error, is like, okay, this is what I'm sensitive to. This lighting, like more fluorescent lighting, seemed to be a little harder, or a lot of background noise. So what seemed to help was, like you talked about, is first of all being aware, okay, this is what I'm sensitive to, and then eliminating those whatever that was. So like when I was in school, and I had to get like almost, sometimes I had to wear like glasses for a little while, or just avoiding a situation where I would be in like I said, Target. I had to take a break from being in those big stores for a while. Also, yeah, just in a quieter area. So just learning to control that environment until I couldn't handle it. But it does get better. It did get better.
Yeah, we see that part does get a little bit better over time, and that it adds on top of the cognitive fatigue that sometimes people, if they're managing that overstimulation, they can it doesn't take as much cognitive effort to complete a task. So it gives them a little bit more room in their gas tank to kind of get a little bit more done. Noise canceling headphones are really popular among my patient population. And then asking people to turn down the lights when they go see their doctor. So when they go see their neuro-oncologist, there's those really bright lights, asking kindly if instead we can dim the lights or use a different light source. That's something that a lot of my patients ask for. So these are just some now we're just kind of going to go into some general cognitive strategies that the research talks about, and then Lilly, if there are some of the kind of best practices how you found to implement these strategies, I'd love for you to talk about them.
Okay.
So reducing environmental noise, we talked about that. Focusing on doing one task at a time and talking it out loud. So if you're going in the other room and you're going to get a glass of water, saying out loud to yourself, glass of water, glass of water, glass of water, to improve your attention and concentration and focus. Asking clarifying questions. Oftentimes in conversation, people will just all of a sudden forget what they were saying or forget what the other person is saying. So just on the last few words of what the other person is saying, be able to repeat that back and ask some clarifying questions to get you back into the game. Practice noticing off-task behavior. So the sooner you begin to notice that you're getting off track, the better you're going to be at being able to retrain behaviorally your attention and your concentration. So if you are able to notice early on that you're getting off track, like, oh, that thing's happening again where I'm getting off track, and redirect yourself back to the task, that's going to really help. There are specific cognitive exercises that can help with that too. So there's something called the NBAC, and also there's some specific mindfulness-based meditation exercises that I use that I think can be helpful. Working on the least interesting tasks when you're fresh. So sometimes there's this sense of understimulation or overstimulation, and if we can work on the least interesting tasks first, that regulation of attention sometimes doesn't allow us to really do well consistently. And so if we can work on our least interesting tasks when we're fresh, then that works better. And also anxiety can have a pretty nasty effect on your distraction and managing distraction. So it's really common that people can get pretty upset at themselves whenever they have a cognitive slip, or they feel really anxious, like, oh my God, I can't find that word again. Like I'm getting like, there's this sense of panic that comes up. So the more that we can encourage, because that takes that's dividing your attentional resources. So the more that we can take break that apart a little bit and take one part of the equation, it helps to reduce our overwhelm. And Lilly, was there any ones in here in terms of nugget pearls of wisdom about managing distraction for you?
Yeah, when I was seeing you going through these different ones, and I've seen how each of these things have actually helped so much over the year or so that I've been trying to apply these. And I liked what you said is like being able to separate something, because it's harder, at least for me now, to focus on multiple things if they're happening all at once. And so if I'm trying to do something and talk to a patient or talk to somebody, I'll kind of put on pause, like I'll talk to them and then do what I'm separating the two. Also, like it says here, working on least interesting tasks first, like making a note. That's what I would need to do, write things down and almost like just remind myself as I'm going somewhere, just to keep myself on track. All of these things work. You just have to find what works for our brain and what helps us with our life. But yeah, I love all of these things. Like you do them all the time.
All right, Naomi, next. So managing memory. So most of the individuals I work with, we talk a lot about there's different levels of memory. So there's encoding or getting that information in. You have to then kind of make sense of it and get it to be personalized or organized, and then you store it, and then you retrieve it. And oftentimes, if we can figure out where you're strong, if you're strong at retrieval and you're strong at storage, then we can figure out where to intervene. And if you're better with visual information versus verbal information, it's good to know leveraging your strengths so that way you can put a picture with a word. If you can't remember where your car is parked, taking a picture of it for you to refer back to later and having a systematic organization for that. Having designated places for items, especially the ones that are frequently lost or distressing or could be pretty risky. So if you're always losing your keys or always losing various objects, having designated places for those, and then every night you spend some time making sure everything goes back to its designated place. So that way you have a reset every day. So if it hadn't went back to its place, you're not worried in the morning when things are hectic that getting out of the house because everything's in its designated place. Slowing down and repetition helps. Oftentimes, if we can slow down and reread things or take our time with repeated practice, like especially multisensory practice. So reading it, saying it, writing it in multiple ways, that oftentimes will help. And the more that we can develop some routines, we can use that procedural memory, that memory we don't have to even think about whenever we are doing things like brushing our teeth or whenever we're doing certain tasks. We go through the same procedure and it just needs less effort. And the more that we can have that routine and that structure on a daily basis, that helps to support memory. Or the organizational strategies I think that we talk a lot about are ones that are visual, Lily. It's color coding of things and, having labels and having placeholders. So whenever people interrupt you, you know where to go back to because you put your finger on it, or you have that procedure tray with all of those tools. So it's a very organized way of kind of going back to things without you having to hold all that information in your mind.
Yes, for sure.
And I remember we oftentimes you would spend a lot of time just practicing those setting up for medical procedures that you would have like a certain visual that you would use, and that repeated practice made things a lot less effortful in the moment.
Yeah, it's so true, because there was all these new information, new words, new procedures, which mean those same things repeat in other parts of our life. Mm-hmm. And that's what it said, like helping to learn to leverage our strengths. So you helped me to figure out that it was much easier for me to, if I could convert it into something visual or connect it to some kind of image or random image or a story, or somehow to connect it all together. That seemed to work for me to be able to remember something. And so it's just, and then again, like learning the habit in that routine, doing that, repeating it over and over, and then it doesn't cost as much energy later, and then I can focus on other things. All of these suggestions really helped, like when I was working with you, and then now that I'm working and doing other things, I still apply these same principles.
And what I really like that you did is, and you continue to do, is track what works and what works for you in memory. And then you just commit to what works, not necessarily judging it for being anything more than just need to get it done. So,
I gotta get this done.
I gotta get this done. I can't judge it for whatever it is. I just gotta get it done. And so I really like that workability. You really focus on workability and management rather than kind of seeing it for something else, which I really appreciate about you. And it adds that resilience I see.
Yeah, learning to be resilient, because it can be really easy to be frustrated. Yeah, for sure.
All right, next, Naomi. So this was something that that Lilly and I talked a lot about, was word finding. So as you know, Lilly talked about that she had went through a course of speech therapy, and oftentimes that's really important for restorative purposes. So that way individuals can have a really good opportunity to make use of neuroplasticity for retraining. But then also there's still functional speech challenges that many of our patients experience. And how that comes up is in conversation. It comes up when there's an intersection between fatigue and language vulnerabilities. There's a lot of ways that comes up, and you don't have to necessarily have a tumor in a language center to have that to be problematic. So some of the research really talks about using paced speech and slowing down your speech. I laugh, I talk about it as like talking like William Shatner without the histrionics, where you're slowing down, pausing frequently, and making sure you're giving your language centers an opportunity to rest as you go along. Many times there's a mismatch between how fast your ideas come up, but how quick your language centers can respond. So you're reducing that gap between how fast your language centers can respond, and also how quickly you can get the information out and thought of. So reducing that mismatch can oftentimes be helpful and allow you to have fewer word finding kind of speech arrests or word finding problems. And one of the things that I love that Lilly continues to still do is gesture when you're talking. So there's been some research about non-specific gesturing, just talking with your hands, how that has a priming influence on your motor language abilities. So because it's an adjacent area to your language center. So having that priming will allow your brain to be able to kick in a little bit more, which I think is helpful. Some of the other strategies, so this is from the Aphasia Association of America. So saying one thing at a time. So if you yourself don't have language problems, but you're talking with someone that does, not having multi-part questions for them, just kind of focusing on one thing at a time. Or if you do have language challenges, asking someone, so I think I understood that first part, but could you say that second part again? I want to make sure and have a thoughtful response. So making sure to just focus on one thing at a time. And you don't have to pretend to understand. There are times in conversation, if you have a language challenge, that you'll just kind of like, it's not worth it. I'm just going to catch up later. But if you don't want to understand, if you don't want to pretend to understand, you don't have to. Not rushing and slowing down, to be patient. Sometimes when we're in the midst of finding a word, we can start to get kind of kinetic and fast, and that's going to make it so that the word comes less quickly, unfortunately. So the more that we can take a breath and slow down and be patient, drop down to a maybe less desirable word that's an approximate word. So that way that you can still get your point across, but it's maybe is not as articulate as once you had hoped for, and grappling with that idea that maybe that verbal specificity is something that you have to work with now, and being able to kind of come to terms a little bit with that. And reducing background noise too, because again, you don't want to have to filter in, you don't have to process, you don't want your brain to have to process that background noise and have to find that word. So the more that you can have those in less sensory kind of overload situations, the better it will be. And Lilly, was there other pieces? I know this was a lot of the work that we did together, so I don't know if there's other pearls of wisdom too that you're thinking of as I was just talking.
Yeah, I think both of those points there is slowing down your pace of speech. As you probably notice, I still fall into that and have to, so if I speed up, and then you can see, I can feel the glitching starting to happen, is what I call in my mind. And because I'll think of a word that I want to say and I can't grab onto it, and then I start getting frustrated. So it's just kind of to slow it down. If it's a word that I can't retrieve and want to say, I'll describe that word. Like what it looks like, and then slowly the brain will kind of usually pull it out, or if I can't, just instead of getting frustrated, just like it says, keep like being simple, keeping it simple, just finding a way around it, just say, okay, well, that's just gonna be how it is, and just find a way. So our goal is, instead of maybe comparing to, oh, I would have been able to do that before, or this is not who I want to like be, is just focusing on being able to communicate and connect, and prioritizing that over being frustrated about not being able to find something. Yeah.
I think those are really wise words.
Yeah. So all of these things work.
So from to do to done. So sometimes it's not about being forgetful. It's not about finding words. It's about just getting things done. I just can't get things done. And then the more that we routinize daily activities, pre-plan and prepare in advance, having slowed thinking speed is probably one of the most common things that I work with individuals on. And the more that they don't have to have in the moment pressure demands, the better it is. And so I think that we ended up working a lot on something called time pressure management, or managing that time pressure. Considering warning alarms. So if you need to leave, if you have a meeting at 10 and you have to kind of put it in, and it takes an hour travel time, having your alarm for when you have to leave, not necessarily for when the appointment is, and taking that in your notes, so that of your calendar, so that way is it tells you when, not just when the appointment is, but when you have to leave. So that's an example of using a warning alarm. Reducing clutter, so sound and visual, like we talked about before. Linking behaviors that could occur naturally. So for example, if you're already, if you have your medications and it has to happen at meal times, then just having those medications right there on the table, so that way you can take them. There's other things that kind of happen naturally. So the more that you can link existing behaviors to new ones, so that way it just becomes a sequence of events that you do throughout the day. And if you have, and know that if there's one-off sorts of activities, those are going to be the ones that are going to be forgotten the most. So, so if there's a routine that you have, and there's one thing out of that routine that is changed, that's going to be the thing that you're going to forget. If you're used to kind of going to your friend's house and then going home afterwards, if you meant to do the groceries on the way home, it's probably going to get forgotten. So the more that you can have some sort of way to interrupt that chain of events, so having a Post-it note on your steering wheel saying, I definitely have got to make sure to get to the grocery store, or something that can be a hard stop. That's the kind of plus and minus of using things that go together, that then you're on that train, that autopilot train, where you won't necessarily be flexible. So just taking that into account. Consider some step-by-step problem solving and goal setting. We're going to do that next. And then again, doing some clustering by getting things done. So we've talked about, in many of my practice, we talk about prioritization based on color coding and urgency. So sometimes to-do lists can become really overwhelming. And if we can break it up by, again, red, yellow, green. Red is the things that have to be done today and have that. And then yellow is being things that have to be done this week. And then green is things that's nice to be done, instead of one whole long list, but grouping it by urgency, and then just focusing on what the small steps of what you can do can help to manage some of the stress to getting things done.
Yeah.
So this is something called goal setting, and we're almost done. And this is one of the kind of central things that the literature talks a lot about, and that I really practice, and that Lilly and I worked a lot on whenever we were taking these ideas from being concepts and putting them into an organized strategy. Because many times, a lot of the things that I've talked about are strategies that people already know about. They already know that they should manage distractions. They already know that they should do one thing at a time. But actually putting it into an organized plan, that oftentimes can be maximally helpful and beneficial. So I thought that, Lilly, what do you think about us kind of going through what this would look like?
Yeah.
Okay. All right, let's do it. So, so what's something that you want to accomplish in the next week?
Okay, so we talked about something that we normally do. So we want to organize our room. So if I need to plan to clean my room this week.
Okay. So, and the goal, just for the audience, the goal should be something that is doable, something you're interested in doing in the next week, or it's something that you're interested in and that have be time bound. So you want to make sure and get it time bound, specific, measurable, and something that's doable. So what are some ways, if you're going to clean your room the next week, what are some on the plan here? How are you going to accomplish that? What are some steps that you would take?
Okay, so then you would break them apart. So in an average room, you'd have to do your laundry, you have to sweep or vacuum. If you have papers, I have like a lot of things to sort, all of those basic things.
Yeah. And so then we'll take the plan and I'll show you in the next screen, I'll show you just in a minute what that will look like. So let's take that plan and let's put some steps around it. So what would be if you were going to do your room and you were going to do the laundry, you were going to do the dusting, and you were going to do the vacuuming. And so when sorting of papers, what would you do first?
So first I'd have to make sure I had all of the things ready to do that procedure or whatever. So make sure I get that. Because the papers and the laundry would be maybe the hardest for me because it needs separating and organizing things. Yeah, so I'd probably do the laundry first, get that done, sorted, put it in, and then tackle the papers and make sure I had my shredder and my files and everything.
And is there anything to do the laundry, is there anything that you would need to do the laundry? Is there any supplies or anything like that you'd want to check up on first?
Yeah, so you have to make sure you have the soap. You have to make sure you have like everything ready. Yeah.
Got it. So we might want to just, so leading up to that, if we wanted to do the laundry that day, then just making sure to kind of, as the pre-planning, so that way not in the moment, we're not kind of feeling rushed to do that. All right, and so how well do you think you're going to do with this?
Well, I think probably if I have that plan, I have it budgeted at a time where I can do it, probably like 75 to 100. That's what my hope is.
Okay, and then it seems like that you kind of hit on a good thing about some of the problems that could arise. So this is in the do. So what problems could arise that you hadn't anticipated? So what are some problems that might arise with getting this done?
Yeah, so life changes sometimes, or maybe, yeah. So like I said, planning at a time, so maybe it doesn't happen or something came up or you had to work later. Yeah, making a plan B. So if for some reason, yeah, so if anything comes up, like finding a solution to dealing with it. So I'm trying to think for problems for.
So what's possible? So it sounds like you're already onto some solutions for that. So making it an assigned time that you could get it done, having a plan B.
Yeah.
Yeah.
Exactly. So budgeting the energy if something happens, yeah. Maybe splitting it up.
Yeah. And so Naomi, can you go to the next slide? So this is what it would look like if we filled it out, and we did lots and lots and lots of these, right?
Yes, particularly for work, like, yeah, it's, looking.
I think what this highlights is that cognitive rehabilitation does not just happen in the session. A lot of it happens outside of the session, and it can be quite a bit of work. So I think that's something that can be a little surprising to folks, is that it's much more of an active process than many people had anticipated.
But it works though, because it kind of makes it more tangible in making it happen. And so that's really exciting to see. This is what I would take with me every day. Be like, okay, we're focusing on this goal, because it's like keeps us focused on what we want to do.
Yeah, and the thing I would always ask you to do is track what works and what doesn't work, and then reincorporate that in the new learning for next time.
Yes.
Yeah. So this is a summary. So again, cognitive changes are common and multi-determined. There's still we're still at the infancy of understanding what exactly is causing these common cause cognitive changes, and they are multi-determined. And managing fatigue and exercise and having a healthy diet are just like the foundational things that are so important to do that. And also having some emotional support, because not only is the rehabilitation hard, but this whole disease course is hard. So wanting to make sure you have the support to be able to do that. And tracking what works to manage your cognitive changes is huge. That oftentimes that is one of the most important things that individuals can do themselves, is tracking what works, committing to workability as we discussed, and being able to make sure and personalize your management plan according to what is important to you. Cognitive rehabilitation has been found to be helpful managing cognitive symptoms, but it's not a fit for everybody. Some individuals really, there's other competing demands, and not necessarily is it a one-size-fits-all. And there's also resources that I think cognitive rehabilitation is not available in many places. So making sure that at the minimum that you talk with your doctor if you're having some of these challenges about some good education for understanding some the cognitive changes you're experiencing, and exploring other kind of modifiable ways to manage that cognition. That's a really good start. And then also talking with your care team and understanding, is now the right time to be tackling this, or are there other competing priorities that maybe we should be thinking about first. So thank you very much for and we're happy to take some questions if there are questions that that people have, and I'll leave it back to Naomi.
Okay, thank you so much, nurse practitioner Alexa Greenstein, Dr. Weyer-Jamora, thank you so much for that, and Lilly Stevens, thank you so much for being on our panel. We do have some questions. Look for some questions here. Okay, so there's a question. I have short-term memory issues. What can I do to improve this problem? So short-term memory, what would you suggest? Yeah. I'll turn this to you, Chris.
Sure. So short-term memory, oftentimes, many of the patients that I work with, it comes up in specific instances, and being able to decode those instances a little bit more, I think, helps. So if it's happening, for example, whenever you're walking to another room and you forget why you're going in there, or in conversations, and it might be happening across the board. But whenever the short-term memory issues are not happening, what do you notice about what helps you to manage it a little bit more? And oftentimes it can be that fatigue can be something that can make that worse, or just being able to refocus your energy and slow down and do one thing at a time can help a lot. Additionally, writing information down at the time, so keeping a notebook with you to be able to write down that information at the time can help.
Great, thank you. Okay, I want to respect time, so I think what I'm going to do right now is end the recording portion of it. And for those of you who wish to stay on and continue the conversation, I will let you know how to do that. But thank you again to our donor, Sheri Sobrato Brisson, for her generous donation and allowing these webinars. And I want to let you know that our next webinar will be on April 15th, which is a Wednesday, same as this, at 5:30. And we're going to be talking with Natalie Ledesma on the ketogenic diet. So we hope to see you there if that's of interest to you. And for those of you who are signing off now, please take a brief survey and let us know how we can improve and topics you'd like to see in the future.